Hey y'all, welcome back to the Nursing Chronicles with Monique. I am Monique. Thank you so much for joining me. Please, if you've not already subscribed, please subscribe to the channel and give me a thumbs up, and hit that little bell that lets YouTube know that you're interested in my content. And it also will let you know when my next uploads occur. So guys, I wanted to do another upload on this pandemic or pestilence that is very fast reaching all corners of the globe. This was, if I'm not mistaken, this was sent to me by a subscriber of mine. I have not seen this on the news, and rightfully so, because it's very embarrassing. But take a look at this. I'll give my commentary and pause it as we go through the video, and then you guys tell me down below what you think. I think this is indicative. Nurses, healthcare workers, doctors, of what really is going on behind the scenes. And so what I will do is play the tape, and I will roll the tape, let you listen to it, give my commentary. And I think this was filmed. This is a representative from Florida, and it looks like they were in California. I've been trying to do my research, but this must have happened either this week or last week, but this is in reference to this pandemic that is going on. And when you look at this film, when you look at this briefing that was done, it's just an eye-opener as to what is going on. So I am going to start it, and I'll pause it, and I'll give my commentary. All right, let's go.
Let me recognize Mr. Mass from Florida for 5 minutes.
Thank you, Mr. Chairman. I want to take a step back and ask that we all recall we have districts back home, and while we deal with national policy, the questions that we ask on this matter to individuals with children, individuals that go to work, individuals that are exposed to people that travel. We will all travel presumably Friday or Saturday back to our home districts. We're in a very international city here. And I feel as though this sense that I'm getting from you all about quarantine not being the right path does not pass the test of common sense. But I don't want to dwell on that right at this moment. What I want to ask first, number one, in the aim of speaking about people that we represent back home, if you were in Wuhan right now, any one of you, you all have experience with this, what would be your first or second or third line of defense? How would you protect your family? How would you protect yourself?
Okay, guys, so he's asking them, and these are supposed to be the officials that are on the front line. And these two women look like, I don't know who they are, and I would hate to be in their position. However, they look like they are caught in their lights, like they don't know what's going on. Let's see what answer that they gave to what would they do.
Would you wear a mask? Would you wash your hands? Does that not work? Would you not touch your eyes or your nose? Would you prevent your kids from going to school? What would you do?
Can I start with, I think, and there are many other primary prevention methods. Health education is one.
Did she just say health education? I hate to be critical at a time like this, but look, health education right now is not working with the pandemic that's going around the world. We don't have time to print out pamphlets. We don't have time to do all of that. You can send out a mass email and tell people to go to the CDC website. He's asking what would they do, and she's talking about health education. Lord have mercy. Let's go and see what else she has to say.
I think if people understand what's going on, and they understand the severity of the issue, and you let them know that how can they protect themselves and their families and their children.
That's the question I asked. If you could answer that for me, it would be fantastic.
That would be...
Oops. He said that's the question he asked. And if you could answer that, he asked, you wash your hands? What do we need to do to protect ourselves? And she goes into health education. So let's see what she has to say, because this is indicative of what's going on, guys. Nurses, doctors, y'all know now. Y'all know I had always been talking about, and I hate to say I told you so. This is the year of the nurse, and the nurses are on the front lines. We are on the front lines of this pandemic, and we're going down quickly. And this is what's going on behind the scenes. Hold on for a minute. Let me restart it back.
Through social media, through any channel we can.
Social media is not protecting anybody in Wuhan.
Knowledge.
Okay, she even mentioned social media. And whoever this brother is over here, he got it right on the head. Social media is not protecting nobody in Wuhan. It ain't protecting nobody over there in California. It ain't protecting nobody in New York. It ain't protecting nobody in Washington State. Who are these people that they hire and put on the front lines like this? Now, I don't know who they are personally, okay? And they may have just thrown them out there in the front. But she's talking about social media. Let me go back.
What do they do to protect themselves? So if there are people that come to our country because there is no quarantine on them because of this academic approach instead of common sense approach, what do people do to protect themselves when they are exposed to?
They are so nervous. You could see the faces. These two poor women, they're probably the brightest, smartest people in their field. And they probably threw them there on the front lines to answer these questions. But that's what happens when we take some of these jobs. And that's why there was sometimes in nursing, I didn't want no position in management. I did not want to be in charge. I'll take care of my patients and be charge nurse. That's it. I don't want no I didn't want management position because it's all of the politics. And when it hits the fan, like it's hitting the fan right now, they throw your butts out there like the sacrificial lamb. And these two women, unfortunately, they're probably the sacrificial lambs of this whole situation. But that's indicative of who's behind running this daggone show. So let's hear. Let's finish here.
Others.
I think what confused me about your question initially is the if you were in Wuhan, and I can't speculate. I don't know what the situation is happening in Wuhan. As I mentioned before, one of the great unknowns about this virus is the apparent discrepancy in what we are hearing about in terms of severity and illness in China versus the more close to 150 cases that have been reported outside of China. The majority of the cases that have been reported outside of China have largely been mild disease, like other respiratory illnesses.
I apologize for cutting you off, but none of you are answering a very straightforward question. Mr. Klain, you're presumably the expert on this panel. If you were there at ground zero, maybe you're not in a full-on tap suit, but what would you do if your family was going to be in an area that was exposed to it? How would you protect your family from this? What is Defense One?
Yeah, so Congressman, I think this goes back to your initial point, which is Defense One would be to get out.
Okay, guys. He said Defense One would be to get out. He's asking a question because in the beginning he's talked about quarantine, and nobody wants to talk about quarantine. Nobody really wants to say that. But his response was get out. Let's see what else he says.
And the problem, I think, for this issue of travel bans and quarantines is that probably hundreds of thousands or millions of people have. Okay.
Thank you. Number one, get out.
Right?
Number two.
Number two would be social distancing. Would be.
Okay, number two, social distancing. Okay, he's trying to get clear-cut answers, and people don't want to say the word quarantine or, social distancing or anything like that. Let's see what else he has to say.
Try and have fewer interactions with people. You asked about keeping your children home from school. What we found in the past is when that happens, people's children leave the house and go to shopping malls and other places where they have contact with people. So, it's a tricky thing.
How would you physically protect yourself?
The only real way, I think, to physically protect yourself is to try to stay away from other people. I think if you're going to have exposure to other people, as we all do, washing your hands, doing things to minimize the spread of the virus is good. But, get out of where the virus is, stay away from other people, and then engage in standard, public health kind of practices, wash your hands, whatever.
I mean, we don't say whatever. This is
whatever. Guys, remember when I told you that healthcare is a business and they're steadily getting this vaccine together? That's a business too. These people, now, like I said, these two women, they probably the brightest, the bestest, but they are the sacrificial lambs. And it's not my issue. That's the positions they took. But his behavior, whatever, in the wake of a pandemic, pestilence, your response being grilled by your officials that are, representatives in the government is whatever. Man, oh man, let's finish listening to what they have to say.
a serious question. Yeah. I mean, washing your hands might be a simple act, but it's a very serious thing when you're looking at a pandemic like this. Dr. Bowie, one of your last comments that you made was about quarantine perhaps only slowing the transmission. Is there at this point a vaccine?
No.
So would slowing the transmission be a victory?
Well, it's a victory for other cities, other countries.
Is it a victory for the United States of America?
It's a victory for human beings.
Great, thank you. Let me recognize Mr. Mass from Florida for 5 minutes.
Thank you, Mr.
Oh my goodness. So do you see this whole situation? Let me see if I can run this tape through, because basically when I tell you this is a hot ghetto mess, let me see if I could play this.
For other cities, other countries.
Is it a victory for the United States of America?
It's a victory for human beings.
You know what? Now, just that small clip, it's only about 4 minutes, but as you can see, no one knows. The left hand don't know what the right hand is doing, and the right hand don't know what the left hand is doing. It's a hot mess of a situation. It's a situation where people are, look at her face. She looks nervous as all get out. She's a doctor. Her name is Dr. Bowie. I'm going to try to look these people up. But, he was asking them straightforward questions and they want to do the dance. Answer the darn question up front. How do people protect themselves? She goes into social media. He says whatever. She's sitting there talking about, I really didn't understand your question because I don't know what's going on in Wuhan. Man, let me tell you something, nurses. Nurses, listen to me very clearly. You are your best defense with staying healthy. You and the Most High. You are your best advocate for staying healthy. If you walk into these situations and you see that you don't have protective PPE, you demand that they give you the PPE. Now, I got another video that I'm getting ready to show you guys the difference of how their PPE compared to the PPE in Wuhan. And that should give you some semblance of how virulent this particular virus is. When you see how those people are gown gloved and masked up, every orifice is covered, and some of their suits that they're wearing have temperature controls in them. So this is I hate to say it. I don't even want to cuss, but it's one of them shows. Oh my goodness. It's a it show. A malarkey show. Malarkey. It's ridiculous. It's like the blind is leading the blind and everybody's going to hell in a handbasket and no one knows what the next one is doing. They can't even answer questions. He said, get out and basically quarantine. That's basically what he was saying, but they won't use the word. Remember I told y'all in my other videos, healthcare is a business. It's about money. And they don't want to say the word because they're afraid that the economy is going to crash. Quarantine means nobody's out spending money. Period. Point blank. Nothing moves. So that's why they've been slow walking it. I told you guys before, it's been a slow bop, as my sons would say, to where we are right now. And where we are right now is there's only a few states that the tests haven't been reported as having this particular virus. But give it to Tuesday or Wednesday, every state in the U.S. will have a red mark that someone has been diagnosed with this pestilence. And I just got a text: the Italy death toll soars amid travel ban. So it is a situation. Nurses, make sure that you make sure that you get the PPE that you require. If you're sick and you're tired and you don't feel well, don't go to work. Please don't. If you're sick and you're not feeling well, make sure that they give you the PPE. If they don't have it, you can't take care of patients. Go and ask the manager, the supervisors, the nurse managers. Hopefully they have the equipment that you need. Take your time. Don't rush, because mistakes happen when you're rushing. But guys, this is just a testament and tantamount of what really is going on behind the scenes in our government too, as it relates to this situation. And the best means of protecting yourself, you know better than anybody else how your facility works. If they got your back, nurses, doctors, look, protect yourself at all means. If you don't have PPE, then that means you can't take care of patients. Boost your immune system, guys. That's really one of the only main things standing between you and this virus. You'll get exposed to it, but if your immune system is in a more optimal predicament, you hopefully will be able to fight this thing off. Click down below. I'm not making any money off of this. Go to my platforms. I'm going to leave the link. Go get your D3. D3 has been noted to, they've done studies as it relates to acute respiratory distress syndrome and this pneumonia. It does help with that situation. There's a less chance of going to that situation, and that's when people end up on the vent. When they go and they get pneumonia and this acute respiratory distress syndrome. D3 is important, guys. We're really low on D3. Start boosting your immune system. I'll leave the links below. Go to the website, order your stuff, get it shipped to you overnight. Start boosting, taking your supplements to help boost your immune system. Get your sleep, get your rest. Try to eat before you go to work. And eat when you come home. Leave those cell phones in the car. Don't even bring them into the job with you. If you're coming on home, wipe down your car, wipe down your cell phones, wipe down the steering wheel, have a set of gloves, some gloves in the car with your wipes, wipe stuff down. Remember, I told you guys, get dressed out in the garage, get undressed out in the deck. Take them clothes, put them immediately and sanitize in the washing machine and in the dryer. The dryer, that heat kills the virus. Wipe down everything, your keys, your glasses, everything. Leave everything. Don't bring nothing into the house if you can avoid doing so. Leave your shoes outside. Spray them down with Lysol. Seriously, wear booties if you have to. But this is a situation where we just have to take all precautions because people, these idiots, I hate to say it, they don't know what's going on. They don't have a clue. And like I said, these two women here, I don't know them. They're probably the smartest women in the world, for all I know. They might have been thrown out there and didn't know what questions they were going to be asked. But when you're in those positions, you have to roll with the punches. If you have a PhD in public health, then you should know the answer to the daggone question, how to protect yourself. I'm a nurse. I know I could answer that question. I didn't have to be confused and look like I'm a deer caught in the headlights. This is what is going on, people, and you have to protect yourself. You know, like I said, you guys know more than anybody else who at your facility, if your facility has your back. Because what happens is, if our first line goes down, which is the nurses and the doctors, look, we got a problem here. We got a serious problem here. Here and everywhere in the United States, we have a serious, serious problem. If our first line of defense, which is our nurses and doctors, get overwhelmed, infected, sick, we are taking care of ourselves, people. I mean, they had to shut the borders down in Italy because so many people were dying. It was overwhelming their healthcare system. It was overwhelming it. There's a shortage of nurses. The average age of nurse is 50. Look at my other video. So if the average age of a nurse, we not young whippersnappers? Not all of us anyway. So guys, protect yourselves. I just put this video out here so you guys can get a glimpse of what really is going on in the background. So you guys can get out of the cognitive dissonance and think that people are going to help you. That somehow or another, that the decisions that need to be made, somebody else is going to do it. No, the decisions that need to be made, nurses, are the decisions that you all have to make. Protect yourself. Do not take care of patients if you do not have the PPE that is required. That's a hazard to yourself, a hazard to other patients, and a hazard to everybody. So make sure that you guys have the PPE you need, which is personal protective equipment, guys. I'm sorry, I'm using these abbreviations, and I don't even know who's listening in on this particular. This is the gloves, the gowns, the masks, all of that. That's what we call PPE, personal protective equipment. So, you guys know. If everybody is dropping like flies, in a sense of, getting infected, then there's a breach somewhere. There's a breach in the protocol. So, we have to protect ourselves. Nobody is more important than you. You want to go home back to your children. You don't want to bring certain things home. And shout out to those nurses, man. Shout out to all my nurses. I don't know, ain't nobody saying it, but I'm going to say it. We are a team. We are a force to be reckoned with because we are compassionate. We care. We take care of people. And we put ourselves on the front line. So to all of my nurses out there, if nobody is telling you guys, we are indebted to you. We appreciate you. We care for you. We are rooting for you. We got your back. I don't hear anybody saying this. Doctors, we got you too. Nobody is talking about the sacrifice that these nurses and healthcare workers are doing here right now. And I said this before because I saw this happening. Nurses are invaluable. You cannot put a price on what you pay a nurse to do. And I believe that every nurse who's going out here right now, they need to start paying them that $8 billion that they just approved. Trump, send that money to the nurses and their families. Send them some money. Don't give us no lip service. We don't want no lanyards. That's not going to help our families. Give each nurse who's going out there to their hospital, send them a daggone bonus of $50,000, $20,000, whatever you need to do. Send it to them. Give the nurses the money. It's not going to stop them from getting infected. But at least if something happens, if they have to stay home, they have a bonus or something sitting there for them. That money should not just go to pharmaceutical companies. Send that money to some of those nurses and doctors on the front line. Put a $20,000 bonus in their account for going out here and risking their lives during this time that we're in right now. This is emergent times. Sign an order for that, Trump. Hashtag sign a nursing bonus for our nurses. Any nurse who's out there on the front line doing home care, any nurse who's in the hospital, because they're all going to be exposed. Sign that order and send the nurses some money. If that's all that you can do, because money is not everything. But somebody's about to get paid $8 billion y'all just signed to help with this situation. Some of that money better go to some of these nurses. And I'm going to keep saying it until it gets to the ears to where it needs to go. Don't just give us lip service and send $8 billion to these pharmaceutical companies. Fine. Y'all go make your vaccine. Send some money to these nurses and their families. That direct deposit that comes through, send them $20,000, $30,000 out of this $8 billion that y'all just passed this thing. Send the nurses some money so their family members can have some security some kind of way. Since everybody else is going to be making some money because it's a business. Remember, y'all? I told y'all that. But anyway, y'all can see how passionate I am about this. We got your back. We love y'all. We are grateful to y'all for going out there, putting yourselves on the front line. If nobody's telling you that, we care about you. We are praying for you. We want you to come home healthy. We want you to come home to your families. We appreciate everything you do because it's not easy. And if you're not a healthcare worker, a doctor, or nurse, you don't know. And yes, I am emotional because what the hell is going on here? But guys, stay strong. Continue the good fight. Take care of these patients, but take care of yourself too. Stay positive. Stay strong mentally, physically. We're rooting, cheering, praying, and loving on you guys from afar, no matter where you are. From New York, from my nurses in New York, where I was first licensed, to the nurses in Cali, to the nurses in Washington State, to the nurses in Georgia, to my nurses in Oregon, to all my nurses out there. We are rooting for you. We appreciate you. And if nobody is saying that, they should be saying this on the news every single day. That should be the headline. After they say what's going on, they should thank you guys. And say thank you to my nurses in New York, nurses across the country, doctors across the country, all the healthcare workers. That's how they should start their meetings every single day. Every news broadcast should start that way. That's what I believe anyway. So nurses, protect yourself. We thank you. We are so grateful to have you, because if we didn't, what would we do? Okay? What will we do without you guys? What will we do without the doctors right now? And some of the nurses and the ancillary staff. We cannot forget about the techs, the ultrasound techs, all the techs, patient care techs. They're putting themselves on the line too. Trump, take some of that money, send it to some of these healthcare workers and help them out. Put aside some money and send bonuses to these nurses, these doctors, and these techs. Ain't nobody saying it, but I'm going to say it. And I'm going to keep saying it until it gets to the ears of the people that need to hear. So, guys, with that being said, I am going to see you guys on the next upload of the Nursing Chronicles with Monique.